There you go. Well, somebody did contact me recently about doing some online therapy. So, looking at that. Anyway, my name is Andrea Martin. I really appreciate everybody coming. This sounds so weird. I feel like I'm at I don't know. When I can't sing, I can't dance. This is so strange. I'm starting to feel anxiety now. This is like really weird. But anyway, I am a social worker, and I was a social worker in Lafayette Parish Schools for almost 12 years. I think it was 11.10 years when I resigned recently to go into private practice full time. I had a private practice on the side for a while, but it just grew, and decided that I'd grown up enough after 20 years of social work to finally do a private practice. I'm going to be honest that I do have notes, and apparently I grabbed the wrong ones, but I'm a Google Doc obsessed person, so I have it on my phone. So I'm going to be looking at my phone, which is something we're all not supposed to do anymore, right? It's faux pas. But anyway, so anxiety is something that I think we all experience on different levels. I think that it is a word that we use pretty often. And maybe when we use it, we're not exactly using it in the right way sometimes, because we think of anxiety as just worry, and it's a little bit more than that. For those of us in mental health, anxiety is one of the most common things that we see. 1 in 13 people will experience it in their life and have it clinically significant, which is something that we talk about as clinical significance. For you to meet a diagnostic criteria. But anxiety is just a general term for a whole bunch of different feelings. There's not a specific mental diagnosis that's just anxiety. Like when I diagnose people, I just don't put anxiety. I have to clarify it, or it's just generalized anxiety. But it's a general term just for fear, feelings of nervousness, worry, negative thinking. It affects our thinking patterns, which in turn affects our feelings, which we all know then affects how we behave, because how you feel often is how we act, okay? And it becomes a disorder when it describes behaviors that mess with your normal everyday functioning. So we all have anxiety, like I said, on a regular basis, and for some of us, it's kind of healthy. I mean, we think about it with our kids here at school. They worry about a test, and so what do? They study. We worry about getting in an accident on the way over here. We put our seatbelt on, okay? We worry about our kids all the time playing outside alone, so we go sit outside and we watch them in the heat, and the mosquitoes are eating us and all these things. So sometimes anxiety serves a really great purpose for us. It makes us change our behaviors, sometimes in a more positive or safer way, but sometimes anxiety can then become bad for us, and that's whenever it becomes clinically significant, and we look at how all of these patterns of thinking and feeling establish into different types of actual disorders. And so I'm going to kind of talk a little bit about the different disorders, and then I'm going to talk about the one that's usually the most common that we see, and then what it looks like, and then what you can do about it, because that's what we really care about as parents, is how is this going to affect me and the people that I love, and if they do have it, then what can I do about it? Because if we know something, we want to try to make a plan and fix it. So anyway, so again, that anxiety isn't something that is super bad. We all experience it. It only becomes major if it messes with our functioning. So I'm going to talk about, there's a lot of anxiety disorders out there, anxiety-based disorders. Let me just restate that. But I'll talk about the ones we see in childhood, okay? And so generalized anxiety, or GAD, I'll abbreviate things, is it's just like general worry. Kids worry about all kind of things. They might worry about you getting sick. They might worry about school. They might worry about their friends liking them. There's no specific worry in this one. It's they can worry about anything and everything, and they often do. So we see kids who worry about their grades a lot. We have a lot of that, especially as they kind of get to be a little bit older. The little bitties don't worry about it as much as when we get to be about 3rd, 4th, 5th grade, and then you really start seeing some of the pressure being put on. And one of the times that we really see kids worrying about grades is around test taking time, okay? If we see that around tests, we're not gonna say, if it's always just around tests, we're not gonna say generalized anxiety. They worry about their grades and they worry about other things, then we're talking about generalized anxiety. Panic disorder is another disorder that we often see with kids. And I have seen actually kids in full-blown panic attacks here at this school. And when you think about, a panic attack, when we experience it as adults, it's scary. And when you are a kid and you're experiencing it and you've never had it before, you don't know what it's like, they truly do feel something really horrible is happening to them. And this being a art school, panic attacks actually are probably more common than you think, especially around performances or after performances or during performances. Kids we have seen, and I have seen the nurse here physically having to walk a child down the hall and tell her to breathe. And literally we sit there and we have done this before and help them relax and refocus. We've used different grounding techniques to get kids to not be in that panic mode, because panic disorder is actually having several instances of actual panic attacks. That feeling of impending doom, that feeling of some horrible thing that's going to occur, and a lot of people think they're going to die, and it really feels like they are. That feeling of something sitting on your chest, pushing you down, feeling like you can't breathe, you can't swallow. We actually can look at the physical changes that a person goes through during a panic attack, and we see elevation in heart rate, we see elevation in blood pressure, we see breathing is so different. So, and oxygen levels actually change. So it's a physiological, an actual physical response to a thinking and feeling that's going on, and we see it physically. So panic disorders are pretty common. Some kids will throw tantrums when they have a panic disorder. After they have it, they feel like they're going crazy. They go, just wild. Some of them will sleep after. They're so physically exhausted. But this one is less common than let's say generalized anxiety. The one we're going to see the most is generalized anxiety. So, okay, separation anxiety disorder is another anxiety-based disorder that we see. And, most of us, if you've brought your child to school when they're little or daycare, we've seen kids get upset and cling to us, and then after a few minutes, they kind of resolve themselves, and you may get a call or a text from the daycare, or you call the daycare back or the school back, and they're like, oh, they're fine. They went around their way, they found a friend, they're happy and doing their own thing. What we see with separation anxiety disorder is that kids will have that persistent response of crying and being upset extended throughout the day. And they can't be distracted from it. They just feel that something really bad's going to happen to their parent, something bad's going to happen to them. We see this a lot with little bitty kids, and then it resolves itself. We start to see this, and when it becomes really bad is a lot of times we'll see it at age 10, which is a rough time for, I know, a lot of kids. Separation anxiety disorder occurs usually maybe after something bad has happened, or kids or become distrustful, okay? So they'll refuse to go to school, and we've had this to the point where we've had kids on homeschool so bad that they can't even come to school. Sometimes they'll make you sit by their bedside until they go to sleep, They'll climb in bed with you. And we're talking not about 18-month-olds, 2-year-olds. We're talking about 10-year-olds needing, to have that there. They really think that something terrible is going to happen if they're not there. And they almost feel like if they can see you, nothing bad will happen. Social anxiety is another anxiety disorder we'll see with kids, and this one again is something that we'll see, and kids can't even come to school. It's characterized by an intense fear of performance and being around people. It's a little bit associated with agoraphobia, but not so much. It's about any kind of being in class, talking to anybody. This one is can definitely affect attendance, and a lot of kids that have social phobia, social anxiety disorder will manufacture a lot of symptoms, psychosomatic symptoms, physical symptoms. They tend to have a lot of headaches. They tend to be the kid that always has a tummy ache. They tend to complain a lot about like muscles hurting, those kind of things, be really, really tired. So we see a lot of kids using those kind of things to avoid social situations, lots of excuses. An interesting one that we don't see very, very often, and I've seen twice in my almost 12 years in the school system, is selective mutism. And this is a really cool disorder because it's a child who has progressed normally and naturally with their speech and language development and acquisition of speech skills and language skills, and then just chooses not to talk in certain situations. They'll talk at home. They have wonderful back and forth conversations that are very intelligent, very entertaining, wonderful, but they choose not to speak. And usually we'll see it in high pressure situations like school, or kids that'll be selectively mute, maybe like at camp or church or something like that. But they're perfectly capable of speech. They have no speech impediment. They're not going to stutter. They're not going to have any kind of delays. They just choose not to. And it's really, really interesting. They'll even like turn their back on people and like not even look at them. It's really, really cool. And interestingly enough, the two kids that I saw in the school system at the time were at the same school. And so I was able to pair them up when I was doing interventions with them. And we would, try to play games, and I practically, stood on my head to try to get these kids to talk. And what eventually just got them talking was all of the games we'd play, and then had to team them up to work together to solve a problem. And so they started whispering to each other, but they would never talk to me for a long, long time. And then once they started whispering to each other, then in session, then they started doing it around school. And then I guess as they felt more comfortable, they started whispering in class, and then they started choosing other people that they were going to talk to, and then they started talking to me. It was really amazing. But I can't take a whole lot of credit for any of that therapy. I think they did therapy with each other and for each other, and so it was really, really cool. But selective mutism is something that you're not going to see a whole lot. A lot of these kids, you'll also, one of them had a very interesting facial thing that you could tell at some points she wanted to talk, and that her decision to not talk was just so hard that she would move her mouth like she was going to try to talk, but nothing would come out, and you couldn't see what she was saying. She had a lot of the stereotypical things that we'd see where, doing things with her hand or twirling her hair or biting things. So lots of oral stuff with them too whenever they choose to be selectively mute. So that's a real interesting one, but one that you're not going to see a whole lot of. And it's interesting because the parents are so shocked when you tell them. Like, they don't talk at all at school. And they're like, oh my God, we can't get them to shut up at home. And I'm like, well, probably because they're not saying anything to school. So parents usually are pretty shocked when they hear about that. So then one of the other things we have is specific phobias. And some of us have some of those, where we're afraid of certain things. We might be afraid of heights. We might be afraid of elevators. We might be afraid of spiders. And what's different about a true phobia is the significant avoidance that people go through in order to avoid their fears. These are people who will climb, 10 10 flights of stairs instead of getting in an elevator. These are people who drive 20 hours instead of getting on a plane. These are people who are so afraid to cross over a bridge that they will go miles and miles and miles out of their way to avoid going over a bridge. And that whenever they do try and attempt to face whatever fear that is, physically they have like panic attacks and physiological changes occur. So you and I can say, oh, so scared of heights, I just can't go up that high. No, these people will have a physical response. So we tend to use that specific phobia very rarely because most people don't have it. And it can be of so many different things. Some people have been afraid of dogs and medical procedures, just all kind of things. A lot of kids will, be very clingy, have a lot of headaches, stomach aches to avoid things that they're afraid of. So OCD is something that is anxiety-based as well, obsessive compulsive disorder. It's, I think we also use this word or this term a little bit more than we should, where we say, oh, she's so OCD, where, maybe somebody's house is like really, really clean. I don't get those people. I don't know who those people are, but if you know one, send her to my house because it's really, really bad right now. And there's all these jokes about like, I'm gonna start a support group at my house for OCD people that like to clean. But I won't charge them, I'll do it for free. I'll do it pro bono. But this obsessive compulsions are actual, like these intense, intrusive thinking that I have to do certain things. And when I was in grad school, I had this one of the other interns, she had this really, really cool girl who, she was so germophobic, she would wash her hands over 50 times a day. And would sit there, and I'm not talking about how, how they tell us, what is it, you gotta sing happy birthday to yourself, or the ABC song or something, when you wash your hands. Do you hear about that when you go to the doctor and they tell you that? Well, look, we have somebody don't they tell you that? What is it, the ABC song, or ABC, happy birthday? I think you're supposed to sing happy birthday twice, right? Twice. Did y'all know that? Twice. Not once, twice. And all the germs are gone. Okay. But these people will do it 25 times. They'll wash their hands 25 times before they leave the bathroom. Obsessive compulsive people will check the door lock 20 times before they leave the house. And if they don't, they're so physically and emotionally distracted by that fact that they can't move on to the next task. People who just really physically, you can see it, the checking, the people who have to have certain things lined up a certain way, or it so distracts them. The people who go into your office and probably fix your the things hanging on your wall. It sounds like she's obsessive compulsive right now. And it's really an anxiety-based thing where you use this to help yourself feel more in control of whatever anxiety base you have. It gives you more control. There are some people who can't even leave their house. Their compulsions become so debilitating they can't even leave their house. It's amazing. I had watched a documentary one time on a guy who I think never left his house for like 3 years, and the therapist had to go to him. It's like really, really cool. Some of OCD is also related to hoarding, and that's a whole different thing. We don't see a whole lot of hoarding with kids. You can see it with kids, we just don't see it a whole lot. Because I think personally the reason hoarding we don't see in kids is that parents intervene with that, and a lot of times when kids aren't there, they'll throw their stuff away. And then they just kind of have to keep finding something to hoard. But there are a few cases of kids that hoard. More often it's adults. That's why I'm not going to talk a whole lot about that. And then post-traumatic stress is related to anxiety. And this occurs with kids who have an intense fear of either they've experienced a moment or an experience of their fear of their own death as a possibility, as a very real possibility, or somebody that they love or are very close to. So maybe it's being in a car accident. Maybe it's watching mom or dad almost die because of some kind of assault. Maybe it's watching grandpa have a heart attack or have a stroke or some kind of big medical emergency. And what occurs is that they really physically disassociate. Like we can see a child, change. Their mind, they kind of go away in their mind. They have lots of flashbacks about the event, nightmares. We see a lot of startle responses, with post-traumatic stress. You might see a kid who, if you go too close to them and maybe reach and it looks like you're gonna hit them, and they kind of do this kind of stuff a lot. They're super, super hyper vigilant. And when we say hyper vigilant, we mean always on alert, always looking around for things. With post-traumatic stress, the event had to have occurred and the symptoms be present for over 6 months. And anything under that, like 3 months or so, is gonna be what we call acute stress disorder. So most kids, when something bad happens, their symptoms will resolve. You'll see some of these same symptoms shortly after the event, but they usually resolve after some time, like 6 weeks, 8 weeks or so. And so then it doesn't become super clinical. But once it's over 6 months and you're still seeing this significantness, then that's when we say post-traumatic stress disorder. So GAD, like I said, is one of the most common ones. We'll see the generalized anxiety disorder. So, we know that kids have worry. We know they worry about things. We know this happens. So when should we worry about it? Because as a parent, we want to know, when is it normal? When is it appropriate? When should we, look at things? When you're looking at worrying not going away, it's so consistent. When it gets worse, instead of it getting better, like a kid may have a test on Friday and they start worrying on Thursday night, and then it slowly increases where, they have a test on Friday and they're starting to worry about it and obsess about it on Sunday night, Monday night, then we're looking at this is, pretty significant and things are growing, and it's, the constant talking about what they're worried about. When they start avoiding things, like maybe they were a soccer player and now they're avoiding going to games, they're avoiding going to practices. A lot of times they're going to use physical complaints to avoid that. And then in mental health, we often look at a couple different things where we ask you about eating. How's their eating? Are they eating less than they used to? Are they losing weight? Are they not eating at all? Are they sleeping too much? We see that with depression a lot of times. But with anxiety-based things, sleeping is affected where the kid will go to sleep, but they have trouble staying asleep because the thoughts keep coming in. So they're waking up in the middle of the night and they can't go back to sleep. So that's one of the things we say with anxiety. With depression, we usually say somebody sleeps too much or they can't go to sleep. So with anxiety is they can go to sleep, but they wake up usually in the middle of the night, unable to go back to sleep. So again, if it gets worse, if you're seeing it more often, if other people are mentioning it to you and noticing it more, especially people that are close to you, neighbors or whoever, that's kind of when you say, maybe we need to look at that. Okay, so what does anxiety look like? And in the school system, we have to be really careful, or they have to be really careful. I'm going to change my wording now that I'm on the system, but we have to be really careful because a lot of anxiety looks a little bit like ADHD. So we have to really look closely is this ADHD or is this anxiety? Because what we're going to see with anxiety is a lot of restlessness because they're moving around in their desk, they're swinging their feet, they're tapping their pencils, maybe they're messing with their hair. With anxiety, we might see kids picking at scabs. We might see kids who are chewing on things. We have a lot of kids who will chew on the ends of their shirts or right here. It's really, really noticeable and pretty gross. Chewing on pencils, chewing on erasers. We have kids that'll eat their erasers. Yeah, it's pretty intense. So, but we also see some same things we're going to see with ADHD. We see with anxiety, not being able to concentrate. because their thoughts are distracting them. So again, we have to be very careful of asking a kid, what's making you not pay attention? Okay? Is it your thinking and the negative thinking that you're having? Or is it the fact that, you know, you are distracted by another kid that's doing something? That would be ADHD. When we're looking at anxiety, we need to look at your thinking patterns. What's keeping you from focusing is usually their thoughts. Poor memory is also something that happens with anxiety and ADHD, so that poor short-term memory. But again, we have to look at the thinking is they can't remember things because their thoughts are replacing what they just learned. The thoughts of what's going on at home, something bad happening to my parents, I need to move this pencil 1 centimeter to the left, those kind of things. Being tired is something that we see a lot with anxiety. It's very, very draining for these kids, but you also have to think too, they're tired because they're not sleeping at night too. So we gotta look at that. We also look at muscle tension. A lot of these kids that have anxiety, and think about you, like, you ever driven in a really bad rainstorm and you notice yourself after, you get out of the car because your hands have been so tense and you just, you've paid so much attention to the road that your body hurts? Well, I mean, that's what these kids all day long, they're kind of like tensed up, worried about something else. So we see muscle tension problems with these kids. We also see irritability with anxious kids. They're grumpy. And sometimes we'll just have normal kid grumpiness, but this is like consistent irritability because their anxiety makes them so on edge. If you think about, let's say you start your day with your anxiety level about here, just as just being regular everyday Joe. A kid with anxiety is going to start their alert level here. And so any little thing that occurs, they're already so close to going off here that it doesn't take much to set them off and to be irritable, okay? So, they're hyper aroused. So they tend to react faster to things that normally maybe would not upset another kid. So, what else does anxiety look like? You can't say that their anxiety, their worry, their restlessness, their agitation, the shakiness, all of those things, the breathing changes, can't be caused by a medical condition. That's something that we hear about a lot as one of the things that rules out whether or not it's anxiety. And it's not because they're taking any meds, because sometimes we have a lot of restlessness with kids, and some medical people may know this. Kids that take like steroids, they'll be anxious, restless, not sleep, all of those kind of things for a while. The thing is it persistent? Has there been no introduction of a change medically? And that there's not other kind of medical stuff going on, okay? So some of the other things that we'll see, like I said, the stomach problems. My daughter had anxiety so bad that we thought she had appendicitis. She would get stomach cramps to the point where she would miss school so much, and then they were like, well, maybe it's appendicitis. We had to go have an MRI and all kind of things. Ended up, I started talking to her and found out, it's anxiety. So I sent her to a counselor because she wouldn't listen to me. She wouldn't talk to me. Headaches. Kids with anxiety have a lot of headaches. They're going to complain a lot about headaches of here. So that's one of the things that we notice with stress is it's on top of our head versus like if, or here in the back, if they have their jaw clenchers. You'll see kids that grind their teeth at night that have anxiety. That's when you should talk to your dentist about whether or not a mouthpiece mouthpiece will help them. Nail biting. I had somebody that called me for an appointment on a kid who would peel so much of the skin back that her fingers were bleeding, and she pulled so much of the skin back right here too that she really didn't have any nails left. It was pretty bad. So nail biting, picking at things, picking at your skin, pulling hair. And when I say pulling hair, okay, there's a condition called trichotillomania. I just love saying it, and I love trying to spell it, and it makes my head hurt. But that's when people specifically will pull the hair out to make themselves feel better. When I'm talking about hair pulling, more so that it's more of a twisting thing this time, and it's incidental that the hair is being pulled out. With trichotillomania, the intent is to pull the hair. With just generalized anxiety, what you'll see is it just happens to happen that they're messing with their hair so much that it comes out. My nephew does that. The hair twirling. My twin sister and my older sister twirl their hair, and she's left-handed, my sister, and I can't do it. And I don't know if it's just because I'm spastic or maybe I'm not nervous enough or something. But look, I'm not even doing it right. But man, she could do it so fast. It's unbelievable. I know I need to watch. You do it too? Holy cow. You tied it in a knot? No, she didn't do that. And look, when we were in high school, we had a stick shift that we shared. You should see she would drive the car, twirl her hair, and never stop twirling. Scariest thing you ever see in your life. Okay? And yet she was still a better driver than me. She still is. Okay, so then on sleeping, not eating, negative thinking, ritualistic behaviors, and rocking. Like I'm doing it right now, but it's because y'all are looking at me and I'm trying to sound smart. And that's stressful. But a lot of kids will rock. You know, we have a lot of rockers when they have anxiety. Think of something else. What am I missing? You had a lot of anxious kids in your class.
Thanks.
In the last couple years. I saw more of you than you wanted me to see of you.
Well, I found a lot of the problem to be is that they couldn't sit on their bottom,
Mm-hmm.
and it didn't have to do with, hyperactivity. It just had to do with when it happened to be a test and they have to be really concentrated. They had a hard time sitting on their bottoms. They would sit on their feet, and they would fall out of their chair.
Yeah,
that would become an issue sometimes because they couldn't. They would always sit on their feet when they were.
Which sometimes helps kids with ADHD, and she's one of the teachers that lets them do that. She's pretty cool. She was even her and her team partner who was here earlier were really cool. They had a lot of anxious kids in their class. They're really, really cool to work with. We had something called Turtle Time in their class that we had kids that we worked with, and I had this cute little story of Tucker the turtle. He was grumpy and worried about things, and he would be mean to his friends. And we talked about how turtles, when they're scared, they go into their shell, and so we kind of need to do that. And so she had a little corner set aside with the little Tucker the turtle, the things that you're supposed to do, really cool. And so that kind of helped kids in her class whenever they were getting really anxious and worried. One thing that you're going to find at this school is that you have teachers that are very open to keeping the kids in the classroom. They don't want kids leaving their class. So they'll let them have a little timeout area. Oh, heck yeah. Give me something for them to calm down as long as they're listening to what I'm saying. So you're very lucky your kids come here in terms of the support that they have, that, some of our kids are different, experience things a little bit differently maybe than other kids. They're unique. They tend to be much bigger thinkers. They tend to be more creative. I think they tend to put more pressure on themselves. Therefore, we see a lot more anxiety here. There's more pressure with the arts because, they want to do well. They want to get the art that they want. They want to do well in that art. And then they also know that they have to do well enough at this school to go on to the next one. So I think that this anxiety discussion is appropriate very much for this school, because on top of the academics pressure that they're put on just because, this is still a school, on top of that, they have the creative pressure to excel at that. And that's a lot for these little minds to deal with. I mean, we think about kids not being able to, identify their feelings really easily. They don't have the cognitive, the thinking skills that we have to think, all right, wait, what's going on? If I start to be a little grumpy around my house or start noticing things, I have the skills to rationalize, hey, wait, let me take a step back. Let me think about what's going on. Oh, okay, wait a minute. I know. I got a full schedule at work. I'm dragging kids around to different sports events, and then I also have my mom coming this weekend, and I gotta make sure the house is perfect because she's OCD. Okay, so I can rationalize that. I can think through that and say, oh, Mela, I'm anxious. Kids can't do that. Kids don't have that skill yet. They have to learn that skill, and it's part of our job to teach them that skill. So how do we do it? We know we have an anxious kid because we've seen it. Okay, so you see the restlessness, you see the agitation, you see the negative thinking, bad things are always happening. And when we talk about negative thinking, we're talking about kids saying things like, I can't do anything right. I'll never get this. Bad things always happen to me. I should get this by now. Those are some red flag words. I like to work with kids and talk about red flag words. Anytime you see or hear those words, those always, those nevers, those shoulds, that's pretty much a warning sign that maybe what you're thinking is probably not the most positive for you, and it probably is a little detrimental. It's not so good for you. So I tell kids that all the time. Let's start writing down what our thoughts are, and then we look for those key words. And how many times are we seeing them? We're seeing them a lot. Hey, red flag, something's going on, let's look at it, okay? And we talk to kids about, you know, hey, I see that you're anxious. Okay, tell them what you see. I see that you're tapping your pencil. I see that you're moving your foot around. I see that you're wiggling in your chair. I see that it's hard for you to concentrate. You must be anxious. You have a test this week, huh? Let's talk about that. Identify for them, acknowledge it. Hey, I see what's going on. This is what it is. Label it. They don't know what it is until we tell them what it is. When your kid was little and you wanted them to say cookie, did they know what cookie was? No, we taught them. We showed it to them. Cookie, cookie. We said it 35 million times until they finally said it, right? We have to do that with feelings too. They don't know what they are. There's no little program that they flip a switch when they're 6 and say, I know what sad is, I know what angry is, I know what anxious is, I know what... We have to teach them. And you do that by telling them what you observe so they can connect it, their behaviors. Then they start thinking, oh, okay, this happens a lot more than I realize. Tell them that you feel that way. Normalize it. Because we all feel anxious. Oh, I know how you feel, you know. I've been there. Listen, at work, when my boss comes up to me and I'm not expecting him to come around me, it makes me nervous. You know, or I have to talk to the boss and ask him for a day off. Man, my palms get sweaty. My heart starts to race. I start to sweat in my head. Maybe, you know, talk to him about what happens with you. Normalize it. Hey, it happens to all of us. And then you say things like, you know, when that happens, this is what I do. I take big, deep breaths in and I blow them out. Or, you know, I go exercise. I don't know who those weird people are that exercise. They say it works. You might want to tell them, okay, you know, when I get anxious, I talk about it. Or I draw something. Or I go for a walk. Walking's not that bad. I don't consider that exercise. Reduce their stressors as much as you can. So if you know they're stressing about school, and you know they have a big test on Friday, and maybe there's going to be 25, how many you know questions you have on those big horrible mean tests you give those kids? Break them down. No, she's awesome. Math genius that she is. She's a math genius. Did y'all know that?
I don't teach math anymore.
What?
I'm a computer lab teacher now.
Shut the front door. Good for you.
I teach everybody.
So she didn't do math genius stuff. I'd actually understand stuff when I sat in your class. Okay, so break it down. You know, if you know there's 25 questions on the test or terms, break them down. 5 Monday, 5 Tuesday, 5 Wednesday. You know, help them. Tell them, okay, let's look at, and usually they will tell you what they got planned for the week, right? My kid's teacher did, and they're in Lafayette Parish. So break it down. That reduces their stress. Let them have breaks. Frequent breaks while they're studying helps reduce stress. One big thing that I know a lot of the teachers have done too, that if looking at a math sheet that has 25 questions scares the bejesus out of them, fold it in half. Nobody says you can't fold their homework. You know, let's do 1 page and then we'll go eat some graham crackers or drink some juice. Run around the table and sit back down, whatever it is you need to do to get that out. And talk to them about it. Hey, you know, let's talk about how you're feeling right now, because sometimes that helps. Okay, one easy thing you can also do is teach relaxation skills. Okay, so how do we do that? Everybody's different in what they like, okay? And little kids have a hard time with visual relaxation or meditation, going somewhere like we can, I when I'm stressed, I may be able to sit and close my eyes and envision myself in my happy place, in my backyard, listening to the wind and the trees and the birds chirping, and I'm sitting in my little outdoor recliner chair, and I got some happy little tunes playing. I may have a little cold cocktail in my hand, and I can do that when I'm stressed, right? Kids don't always have that ability to go there in their mind, so we have to do some more, maybe more concrete things with them. Okay, so they're having muscle tension. You can just very easily teach them to clench and release, and it helps release some muscle tension. I have a kid that really likes to do this. He doesn't like to do that. He said, doesn't help him. So when he sits in his chair, he puts his hands on the sides of his legs, and he tries to push himself up. And that helps him release a lot of his anxiety and tension. So he's pushing, okay? And that helps a lot with kids who have muscle tension. We do some really cool stuff in therapy. I know Sonia, Miss Hartley has pinwheels. We do pinwheel breathing. Because when you think about when you breathe, okay, this is going to sound really weird, y'all, especially in a microphone. But when you're anxious, you're kind of doing, right? But if you want to calm yourself down, you need to take a big, deep breath in and then blow. Right? Well, how do you teach a kid to do that? Well, pinwheel, right? Do y'all know what a pinwheel is? Or am I too old? The thing that spins around? That's a pinwheel. Or bubbles. How many of y'all have blown bubbles? There you go. How do you blow bubbles? Do you do and get a whole bunch of bubbles? No. You might get one if you're lucky. When you blow bubbles, you take a big deep breath in, and then you blow it out. Slow and steady, right? So that's an easy way to teach kids to bubble, to belly breathe. And that's yoga breathe. Yeah, I don't do yoga. I want to try it though. I think I'm too old and fat. Like things are going to get in the way.
Just lay down and just breathe.
Well, that sounds like fun. That sounds like a nap. Yeah. No, there is some really cool meditation things, and I do talk to kids about being still like a frog and stuff like that. Anyway, we do pinwheel breathing. We do bubble breathing, blowing bubbles, star breathing. We have these real neat little star things. We even have some really cool finger labyrinths that a kid can trace. It's really cool. That's one of the things that we like to do too. We talk about that. Easy thing is, hey, we want to talk about square breathing. We want to talk about bubble breathing, pinwheel breathing, star breathing. I tell kids this all the time, that one good way to, and here's the thing, you got to teach these kids this when they're not anxious. That's another thing. Get them when they're calm. Because it's kind of like free throws, You practice free throws when you're not in the game so that when you're under pressure, you make it, okay? My kid was free throw champion in his age group this summer at Brad Boyd's camp. I just want to point that out. That's how much he does free throws. He's 10 years old, a little rock star. Anyway, so we always have a hand with us, usually. Most of us do, anyway. And so I like to tell my kids, if you want to focus on your breathing, we kind of got to do things in groups. We talk about square breathing is doing it in 4s, star breathing is doing it in 5s, because it gives you enough time for your body to adjust to that type of breathing, okay? Because if your body is stressed, you have to have enough time to readjust your breathing, okay, to take control. So what you do is you take your hand, and you're going to use your other hand and trace, and watch this. I'm going to do it without the microphone.
Just turn it on. Yeah.
Okay. So you put your hand up and you tell the kid, and this is a good part of mindfulness, because when we're talking about mindfulness, I used to use this thing when I did